Good afternoon, everyone who has already joined us. I'm going to give you just a few seconds to filter in, and we'll start when we've hit a critical number of folks who are joining us. I'm so pleased by the number of folks who have registered today, so I'm happy to see you all here. All right. We're hitting the 300 mark, which is wonderful. So when things slow down just a titch, I will get started. All right. Good afternoon, everyone. Thank you so much for joining us for today's information session for families and caregivers webinar, featuring guest speakers from the Ontario Ministry of Long-Term Care. My name is Sam Peck. I am the Executive Director of Family Councils of Ontario, and it's my pleasure to host today's session. Before we get into more of the content, we just want to take a moment to acknowledge the land we're on. FCO's work and your work, the work of long-term care homes, family councils, family caregivers, our ministry colleagues, takes place on traditional Indigenous territories across the province we now call Ontario. And I only speak for my team, but we are really thankful to be able to work and live on this land. Indigenous peoples were the original inhabitants of the land now called Canada, and there are actually 46 treaties and other agreements alone that cover the territory of Ontario. We are so appreciative of the Indigenous First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of long-term care homes and communities across the province. At FCO, we believe it's important to offer a land acknowledgement as a way to recognize, respect, and honor this territory, the treaties, the original occupants, their ancestors, and the historic connection they still have with this territory. You can learn more about the people, territories, and languages of the land on which you live, work, and care at a great website that is native-land.ca. For example, I live in Hamilton, a beautiful city with waterfront access, beautiful escarpments and valleys, and it is home to Anishinaabe, Haudenosaunee, Attawandarock, Mississauga, and Mississaugas of the Credit First Nation. As part of our commitment to reconciliation, we are providing educational opportunities to our staff to learn more about our shared history, Indigenous presence and land rights, impacts of colonialism, and the harms that have been inflicted on Indigenous peoples. While we're early on in our journey towards true reconciliation with Indigenous peoples across Ontario, we've committed to establishing mutually respectful relationships with Indigenous communities across Ontario. And it's because we are so grateful for the opportunity to work across Ontario and its many diverse communities. So thank you for listening to that important statement that is actually something quite meaningful to us at FCO. Before we turn things over to our guest speakers, few logistics. You'll notice that you are in listen only mode. So you can hear us, but we can't hear you. In addition, the chat has been disabled for the webinar. If you have any issues during the session, email me either at info or SPEC, S-P-E-C-K, at fco.ngo. You could also reply to the confirmation or reminder for this session. We've also protected time for an interactive question and answer period. At that time, we're going to invite you to use Slido, and that's where you'll pose your questions to our ministry guests. They'll give you a little bit more details on this, but it's a great way to upvote or to like questions to prioritize them for today's speakers. In addition, today's session is being recorded and will be made available following our time together on both via our website and our YouTube channel. Information on that will go out in the subsequent e-bulletin and again posted on our website. Now, without any further ado, It is my pleasure to introduce the first guest speaker this afternoon. Lori Coleman is the director of the Long-Term Care Response Branch and is up first. Over to you, Lori.
Thank you very much, Sam. Thank you for that warm welcome. And a good afternoon to everyone. I'm so pleased that we have so many registrants and people attending today. Again, my name is Lori Coleman, and I'm the director with the Response Branch at the Policy Division at the Ministry of Long-Term Care. I really want to thank all of you for joining the session today. We did have an opportunity to connect yesterday with residents across the province, but we certainly greatly value the opportunity to connect with all of you today. And we recognize the important role that family and caregivers play in the quality of life for residents living in long-term care homes. I also really want to thank Sam and everybody at Family Councils Ontario who have provided us with support in connecting us with you today. There's a lot of logistical work in the background, so my many thanks to Family Councils Ontario. We're here today to share some updates with you and to talk about the impacts that will have in long-term care homes. We very much value your perspective and want to hear from you. And so we've saved time, as Sam mentioned, at the back end of a presentation for a question period, which, as Sam mentioned, we'll be using Slido for. Most people find it helpful in using Slido to watch the presentation on their computer and to use their mobile phone for Slido. You can either scan the QR code on the screen or go to slido.com, that's SLIDO.com, and enter the event code, capital MLTC 0921. So again, that code is capital M, capital L, capital T, capital C, 0921. At that location, you'll have the opportunity to submit your question and to vote up questions so that we're able to work to respond to the questions that are most important to the audience that we have here today. A special thanks to people who took time to submit questions to us in advance. But if you haven't had an opportunity, again, please input those questions into Slido. I do want to highlight, though, that for people who submitted a question in advance, we've preloaded those into the tool. So you should see those there already. You will note that they may have been edited slightly because of the maximum character limitation in the Slido tool. So I think with that, we'll move on to the next slide, please. Why are we here today? The fall and winter seasons are when cases of respiratory illnesses typically increase. And this, along with the presence of COVID-19, is expected to put further strain on hospitals and long-term care homes. As you may have seen, the government has implemented a plan that takes action to make sure that we're ready and that people get the right care in the right place. Today, we want to talk about a few things. First, we want to share information on Ontario's plan to stay open, health system stability and recovery, and its connection to long-term care. We also want to provide updates on the new bivalent COVID-19 booster dose, and also to share information on the new ministry supports that are available for residents and homes. We want to talk more about what providing the right care in the right place means and what residents can expect. And again, coming back to really wanting to hear your perspective and to receive your questions so that we're able to respond. Next slide, please. Last month, the government introduced a plan that will help support the healthcare system to stabilize as it recovers from the impacts of COVID-19. This plan focuses in 5 key areas. First, preserving our hospital capacity. through prevention of respiratory illnesses. And this can be achieved by ensuring Ontarians, including residents, are up to date with their vaccinations. Next, the second pillar calls for providing the right care in the right place by connecting patients, seniors, and residents to the most appropriate care and reducing the number of emergency department visits. The third category examines further reducing surgical wait lists through the province's surgical recovery strategy. Next, easing pressure on our emergency departments by supporting hospital doors to stay open and improve access to primary care. And lastly, further expanding Ontario's health workforce by investing in our healthcare professionals and providing them with the resources, support, and guidance they need to continue to provide better care. There's been lots of questions and discussions about this new plan, specifically when it comes to ensuring the right care in the right place. We're going to spend some time talking more about that part of the plan later in the presentation today, including the legislation change under Bill 7 that's designed to support patients who no longer need hospital treatment by transferring them to long-term care homes. The change enabled by this legislative change will not only improve our hospitals' capacities to provide urgent and surgical care, it will provide alternate level of care patients in hospitals with an opportunity to experience a better quality of life while waiting for a preferred long-term care home. This new law comes into force today, and this information session will further explain what the new changes mean for you and your loved ones. But before we turn to that, I'm going to pass the presentation over to my colleague, Christine Luero, who's the director with the Long-Term Care Projects and Recovery within the Policy Division at Ministry of Long-Term Care, to provide you with updates about the COVID-19 vaccines. I'll turn it over to you, Christine.
Thank you so much, Lori, and good afternoon, everyone. As Lori mentioned, my name is Christine Loureiro, and I'm the director that's been supporting pandemic response for the past several months. And I'm pleased to be here with you today to give you an update on the bivalent booster. In preparation for the fall season, as Lori mentioned, the ministry's been working to support homes to make sure they're ready for the fall season when we do expect there to be flu and COVID and other respiratory illnesses circulating, such as we've been sharing tools to support them to be prepared to respond to any outbreaks. Part of that fall planning also includes us working with the Office of the Chief Medical Officer of Health to determine what the right measures are to be in place at this point in the pandemic. And while I don't have any updates on that front for you today, if and when we do have updates to these measures, I'd be happy to come back to do another webinar with you. The key piece that I want to talk to you today about is around the fall booster, which is another key element of our fall preparedness plan, and ensuring that residents living in long-term care, their essential caregivers, and staff have access to the new bivalent booster. Last week, the government announced that the bivalent booster is now available to all long-term care residents, their caregivers, and staff in long-term care homes. While it's generally recommended for individuals to get the booster 6 months after your last dose, you can also get it as early as 3 months after your last dose. And we encourage everyone to speak with their clinician about what's best for you or what's best for your family member. Long-term care homes will be supporting on-site clinics so residents can get their boosters in their home. Some homes may also be able to offer vaccine clinics and offer vaccines for their essential caregivers. So you should inquire with the long-term care home to see if that's available to you. If not, all caregivers should also have access through clinics available in the community or through your local pharmacy. Next slide, please. The bivalent booster is a vaccine that targets both the original COVID strain as well as the Omicron variant, which is the variant that is predominantly circulating around Ontario currently. We know many residents and caregivers and staff got their booster, several months ago and are likely experiencing waning immunity. So getting that booster will help restore that protection against symptomatic infection and severe illness. Also a note here that the flu season is also upon us, and the flu vaccines will soon become available as well. And you may get the flu vaccine at the same time as your COVID bivalent booster, or you can get it at any time before or after your COVID booster. So just strongly encourage all caregivers, family members to get their bivalent booster as soon as you become eligible, and also encourage your family members, the residents in long-term care homes, to also get their booster once they become eligible. Thank you. And with that, I am turning it over to my colleague, Erin Gould from the Funding and Programs branch.
Good afternoon, everyone. So I'm Aaron Gould, and I'm a manager in the operations division of the Ministry of Long-Term Care. I'll be walking you through what enhanced supports are available. So as noted in the recent announcements, the ministry is expanding access to specialized supports and services to support safe transitions into long-term care through new investments in 22-23, including funding for Behavioral Supports Ontario to establish and expand current programs and purchase more therapeutic equipment and supplies to support new residents moving to long-term care homes, as well as investment to sustain and expand the Baycrest Virtual Behavioral Medicine Program that provides services for individuals who have dementia and/or responsive behaviors, and funding to create a new local priorities fund that will be administered by Ontario Health to help long-term care homes care for residents who have needs that are beyond their existing capabilities, as well as for residents who develop new medical needs. And with that, I'll now hand it over to my colleague, Anita.
Thank you, Aaron. And good afternoon, everybody. My name is Anita Hooper, and I'm a director in the Ministry of Long-Term Care's Operations Division. So in addition to the COVID-19 measures that Christine spoke about and expanded funding supports that Aaron just mentioned, the ministry has made some related policy changes that I'm just going to talk to you about very briefly here. So first of all, we have reopened respite care and convalescent care program beds. So these are the short stay programs that are in long-term care homes, and they were closed at the beginning of the pandemic. So homes who had those beds are now able to reopen them for community respite care or short stays required for people who have been in hospital but aren't yet ready to return home. And so individual homes who have those beds, and they will work with their local Ontario Health representative to decide whether they would like to reopen those beds now or in the future. We are also increasing the number of available beds in long-term care homes. So early in the pandemic, the public health advice was to have a number of beds kept vacant so they could be used to isolate people who had COVID-19. And as we know, long-term care residents have very high rates of vaccination, as do staff and caregivers. And the ministry has recently updated requirements for emergency planning in long-term care homes. And that includes planning for respiratory outbreaks and pandemic planning, and no longer requires homes to keep beds vacant for isolation. What homes do need to do is to identify their plans for isolation. And that's based on the configuration of the particular home. And so what they may decide to keep some or no long stay beds vacant. And so what that might look like in one home. So if a home has all single bedrooms, then they may not need to keep any beds set aside for isolation purposes. Some homes have chosen to use therapy rooms for their isolation beds, so they don't keep their long stay beds vacant. And then there are other homes who use off-site locations for their isolation purposes. So it's really up to the individual home, and sometimes working with their local public health unit, to determine what the best course of action is for that particular home. And then as part of work underway, we're continuing to increase the number of staffing hours for direct resident care. And this is the $4.9 billion investment that is to hire 27,000 long-term care staff over 4 years. And this is to help residents receive an average of 4 hours of direct care per resident per day by March of 2025. And this is the funding that started to flow to homes last year. So with that, I am going to pass the slides over to my colleague, Kelsey Gershen.
Thank you very much, Anita, and good afternoon, everyone. My name is Kelsey Gershen, and I'm the Director of the Policy and Modernization Branch in the Policy Division at the Ministry of Long-Term Care. Earlier, you heard Lori speak about our broader plan to stay open, which included 5 areas of focus. I'm going to talk a bit more about that second area, providing the right care in the right place. This area aims to connect people to the most appropriate care setting while also preserving our hospital capacity for those who need it. It includes adding the new supports and services that Anita just spoke about earlier, and also helping people access the right care and the right services that meet their particular needs. So what does this mean for people who are in hospital, but who no longer need hospital care? A hospital is not always the appropriate care setting for a patient, nor is it a home. A patient is designated as needing alternate level of care, or you may have heard the term ALC patient, when, in the opinion of their attending clinician, they no longer require the intense resources or services provided in a hospital. In these cases, their care needs can be better met in an alternate care setting. For many ALC patients who are no longer needing hospital level care services, a long-term care home may be a more appropriate care setting. For these patients, long-term care homes can provide a better quality of life. They offer a home-like environment with the availability of social and recreational programming, group dining, entertainment, personal care, and other supports that you cannot often find in a hospital. Sometimes program services and services are available that respond to a person's specific religious, cultural, or linguistic preferences. Next slide, please. To support providing the right care in the right place, changes have been made to the Fixing Long-Term Care Act and its regulation. To start, I want to make sure that I highlight an understanding that these changes do not apply to current long-term care residents who may need to go to hospital for treatment. Also, the changes are grounded in a home-first philosophy that ensures that wherever possible, patients arriving in a hospital are supported in returning to their home. But, of course, where that is not possible, the changes will facilitate the admission of eligible ALC patients, those patients no longer needing the intense services of a hospital care setting, into a long-term care home while they wait for their preferred long-term care home. They aim to support a new conversation between an ALC patient, hospital, placement coordinator, family, and caregivers about how and where a patient's needs can be best met outside of a hospital. They require placement coordinators to continually engage a patient, their families, their caregivers, and to make every effort possible to obtain consent at each stage of the admissions process. However, if consent is not provided, the placement coordinator will be able to move forward with the admissions process. This includes determining the patient's eligibility for long-term care, selecting a home that meets the patient's care needs within certain geographic parameters, and authorizing their admission to a long-term care home. There's nothing in the legislation that authorizes the physical transfer of a patient, nor that authorizes the physical assessment of a patient to determine their eligibility without their consent. As I mentioned, these changes are meant to support a new conversation to help ensure people are receiving the care they need in an appropriate care setting. This is why, at the very beginning of the process, a placement coordinator must provide a patient with information about long-term care. This information is intended to help ensure they are aware of the regular and revised admissions processes and their options. Guidance has also been developed for placement coordinators to support effective conversations and help long-term care and to support effective conversations and help ensure people are appropriately matched. So those ALC patients are appropriately matched with a long-term care home while they wait for their preferred home. While selecting long-term care homes, placement coordinators must also consider a patient's needs, accommodations requests, and distance from the patient's preferred location. Placement coordinators will also consider travel limitations for loved ones and caregivers, as well as a patient's religious, ethnic, and linguistic preferences. They will work with the patient to identify the locations where they prefer to live, which will guide where the placement coordinator can select homes. Where a preferred location is not specified by a patient, their primary residence, if it's known, or hospital where they currently are located will be used. I spoke earlier about the geographic perimeter that the placement coordinator must consider. The geographic perimeter that uses a 70-kilometer radius from a patient's preferred location will be used across Ontario to select homes, except in the Northeast and the Northwest regions, where the radius will be 150 kilometers. In the North, where there is no long-term care home, or there is very limited vacancies within that 150-kilometer radius, a placement coordinator will be able to select the next closest long-term care home to meet the patient's preferred location that can meet their needs. If a home accepts an ALC patient's admissions, they will be placed on the existing long stay waitlist in the crisis category for the home selected by the placement coordinator and for their preferred homes. Placement coordinators will continue to manage the waitlist, considering the urgency for ALC patients to be placed in a long-term care home, while balancing the risk of hospitalization for community applicants if they are not placed in a long-term care home immediately. Once admitted to a home selected by a placement coordinator, they will remain in the crisis category until they are placed in a preferred long-term care home. Where applicable, their place on the wait list for a reunification priority access bed will be maintained to ensure reunification with a spouse or partner in long-term care. If a patient prefers basic accommodation, but is admitted to a preferred accommodation in a home not of their choice, they will be charged the basic rate until they are transferred to a basic accommodation in that home, or they are transferred to their preferred home. They will also have a choice to stay in the preferred accommodation and pay the appropriate preferred accommodation rate instead of being transferred. As I mentioned earlier, once admitted, they may be supported through an expansion of supports and services that are important to residents, their families, and caregivers. In closing, I'd like to repeat a few points that I mentioned earlier. First, the changes grounded in a home-first philosophy that ensure that wherever possible, patients arriving in a hospital are supported in returning to their home. They will also require that before any action is taken without consent, reasonable efforts are made to acquire consent. And the changes are supported by guidance for placement coordinators to facilitate conversations with patients, their families, and caregivers to ensure their preferences are considered. Next slide. The proposed changes, as Lori mentioned, came in effect today, September 21st, 2022. As we move forward, the ministry will continue to update long-term care residents, their families, and caregivers, and is committed to responding to the questions as they arise. So thank you very much for your time. I'm going to turn it back to Lori, and we are all here and happy to answer any questions you may have.
All right, thanks very much, Kelsey, and to my other colleagues who spoke to the relevant areas. We're gonna pivot now and turn to our question and answer portion for the presentation today. So again, just a reminder for people who haven't had an opportunity to sign in yet on Slido, If you go to slido.com, that's slido.com, you can enter the event code that's on the screen right now. It's MLTC 0921. And you'll see the questions that are posted there. You'll be able to pose questions to us. And if you want to prioritize a question, hit that little thumbs up sign, and the questions will move up in priority order. So we'll get underway and we'll get through as many questions as we can today. So for the first question, which is, and there's a number of questions in here with regards to staffing, I'm going to ask my colleague Erin to join. Erin, the question posed is that residents entering homes have increasingly complex medical conditions and high care needs. What is being done to address staffing, training, and equipment needs?
Thanks for the question. Maybe just start. I'm Erin Shank, and I'm acting manager of the Quality and Innovation Unit in the Strategic Initiatives branch. And our branch works specifically on staffing related initiatives. So in response to the question, as you may be aware, in December of 2020, the government launched A Better Place to Live, A Better Place to Work, Ontario's long-term care staffing plan, or the staffing plan as we like to call it. And it sets out actions to hire more staff, improve working conditions, etc., as well as retention strategies. And at the center of the plan is increasing the hours of direct care provided by nurses and personal support workers, from the provincial average of 2 hours and 45 minutes per resident per day to a provincial average of 4 hours per resident per day. And to support this plan, the government is investing $4.9 billion over 4 years, which will create over 27,000 new full-time positions for nurses and PSWs in long-term care. This funding will also support the increase in direct care time provided by allied health professionals, such as physiotherapists and social workers, to a provincial average of 36 minutes per resident per day by March of 2023. So the government has provided up to $270 million last fiscal and $673 million in this current fiscal year to long-term care homes to increase direct care and staffing increases. The government has further committed investments of $1.25 billion and $1.82 billion for staffing increases in 23-24 and 24-25. Thank you.
Thanks very much, Erin. And before we move on to the next question, I wonder if I could ask Erin Gould if you may have a few comments for us to expand a bit more on specialized supports.
Hello, thank you. Yeah, happy to speak to that as well. So as mentioned earlier, there's additional funding that's being targeted towards specialized supports for residents with complex needs, specifically for an investment in Behavioral Supports Ontario to expand and establish further programming, specifically for specialized staff, as well as therapeutic equipment and supplies, in order to support new residents that are moving into long-term care, and as well as existing residents. And in addition, there's funding that is being released to Ontario Health that will create a new local priorities fund that'll be administered by our partners there, just to help with long-term care homes for residents who have these types of complex needs that are beyond the existing capabilities of the home, as well as for residents who develop new medical needs.
Thanks very much, Erin. All right, we'll move on to the next question. And this question will be addressed by Christine. So Christine, the question is, when an LTC home unit is in outbreak, why are visitors to an uninfected resident restricted or required to wear enhanced PPE?
Thanks, Lori. When a home is in outbreak, they have to work really closely with their local public health unit, who will provide the home with direction on how best to manage and support the outbreak, which can include restrictions on visitors. The public health unit will make a determination about whether the whole home is an outbreak or whether it just applies to one unit. So it's not necessarily that in all outbreaks that the entire home would be under restrictions. Having said that, if a home is an outbreak or if a resident is in isolation, they do continue to have access to their caregivers, so their caregivers can continue to visit them, but of course with the required masking and PPE to ensure the health and safety of all the staff, residents, and the people visiting the long-term care home. Thank you, Lori.
That's great. Thank you very much, Christine. Much appreciated. Just a quick note for if anyone's having difficulty accessing Slido, we would invite you to send an email directly to Sam at Family Councils Ontario. And Sam, if you're there, are you able to share that email address with us again?
Absolutely. So you can either email info, INFO, at FCO, so for Family Councils Ontario.ngo, and that'll get sent to my colleague Leanne, who will forward it over to me. Alternatively, you can send it directly to me. It's S as in Sierra, P as in Peter, E as in Echo, C as in Charlie, K as in Kilo at fco.ngo, and I will forward those questions to the presenters or just post them to Slido.
That's great. Thanks so much, Sam. All right, we'll move on to the next question. And for this one, I'll call on Anita. Anita, the question is, what supports will be provided so families will be able to frequently visit residents who are transferred to a home 70 to 150 kilometers away from their community?
Thank you, Lori, and thanks for the question. So all efforts will be made to place ALC patients as close as possible to their preferred location in homes that can meet their specific care needs and requested accommodation type. So the placement coordinators will work directly with ALC patients and their families who are eligible for long-term care to identify their preferred location. And I think Kelsey talked about like the possible locations could include their first choice long-term care home, the location of a caregiver or family member, or the current hospital. And so this serves as the starting point to look for a home for residents to wait for their preferred homes. And so while we have no new programs implemented at present with these admissions changes, placement coordinators can help families access community-based resources for things like transportation where they are available.
Thanks very much, Anita. All right, so we'll move on to the next question. So the next question is, what will be done to ensure that the care given to the current residents is not negatively impacted by the new rules? And so I'm going to ask Kelsey if you can speak to that, or other colleagues if you would like to provide comments on that one.
Sure, I'm happy to jump in, and Anita, you may want to add to my answer, but just to be very clear that the new rules in the admission process that I laid out earlier do not impact current residents. They are about the admissions of new residents to long-term care homes. So the regulations as they are drafted, of course, are of interest to everyone on this call, and I appreciate all the questions, but they have no direct impact on the residents. In addition, you know, as has always been the case, a long-term care home cannot accept residents if they are not able to care for them, if they don't have the services and supports in place to be able to provide proper care for those residents. So, you know, nothing has changed in the regulation or legislation to that effect. So long-term care homes will only be able to accept residents that they are confident they can provide that care to. And then in addition, as Anita mentioned earlier, there are going to be additional support provided to long-term care homes to help them and enable them to take on these ALC patients. So hopefully all of that will ensure that the residents who are currently living in the home actually don't notice these new rules at all once implemented.
And just to add to that, when a placement coordinator is looking for the most appropriate placement for a new resident, they would be working directly with the long-term care home. So if there were issues associated with staffing, it would be identified at that time.
All right, thank you both. The next question is for Christine. So Christine, can you comment on when we'll see a removal or increase on the limit on the number of caregivers for a resident that's currently at 4?
Thank you, Lori. So while in the past the ministry did have requirements or restrictions on the number of designated caregivers per resident, there is currently no ministry limit on the number of caregivers that can be designated for each resident. Having said that, there may be some homes that have their own individual policies around the number of caregivers. We do, however, still have limits on how many people can visit with a resident at any one time, and that is at 4, whether it's caregivers or visitors visiting at one time with a resident. As I mentioned kind of earlier on in my speaking remarks, we are looking at a number of the current measures that are in place, working closely with our colleagues at the Office of the Chief Medical Officer of Health, so our public health officials, to see which measures make the most sense at this point in time, recognizing we have high vaccination rates and access to therapeutics, and we're learning to live with COVID. So this is the limit of the number of visitors is something we're taking a look at, and once we do have any updates, we'll be happy to come back to this group. Thank you.
Thanks very much, Christine. The next question is, will you provide extra support staff like social work, physio, and activities to homes in light of what was COVID outbreaks where staff are burnt out? And for this one, Erin, I'm hoping you might be able to come forward again to talk more about the staffing plan.
For sure. Thanks. So as I mentioned, the staffing plan has a number of key actions within it that the ministry is currently working through and implementing. And so in terms of the staffing plan itself, as I mentioned, it's looking at initiatives that are to hire more staff, improving working conditions, driving effective and accountable leadership, and implementing retention strategies. So I hope that's helpful for now.
It is. Thank you very much, Erin. We'll move on to the next question. And Anita, I'm going to pass this one on to you. The question is, what measures will be put in place for my father who has physical aggression? I understand long-term care homes can't use restraints, and I want to make sure that others are safe. So appreciating we can't know the individual circumstances here. I'd invite your comments, Anita.
Sure. So for every individual in long-term care has a specific care plan. And so the home needs to work with the clinicians to identify what the care needs are for that individual. And so, and that would include, physical help, medical help, and also for behavioral responses. So all of that would be identified in the care plan for the individual. And in terms of what Erin Gould was talking about earlier on, there have been additional resources identified for homes recently. One is additional funding to Behavioral Supports Ontario, and this is for responsive behaviors. So that is one resource that will, that is being enhanced for homes. So it's possible that they would be able to make use of that for individuals who do have responsive and aggressive behaviors.
Thanks, Anita. Christine, the next question asks, why are no vaccinated family members allowed to visit when we've been tested before entering?
Thanks, Lori. I think the question might be asking why are maybe unvaccinated family members not allowed to visit when they're all tested. So in response to that, the ministry does not currently have any vaccination requirements for long-term care homes, but long-term care homes do have the ability to set their own vaccination policies for their staff or for visitors who are entering the home. So that is a policy to discuss with the long-term care home. We have, however, put some measures in place for homes such that the vaccination policies cannot apply for outdoor visits or for children under the age of 5, and also anyone who's attending for palliative end-of-life care. So I encourage you to speak with your long-term care home about their vaccination policy. Thanks, Lori.
The next question relates to ALC patients with dementia. And so Anita, I'm going to turn to you for this question. Up to 2/3 of residents in long-term care have dementia. And how do long-term care homes plan to take on these new residents with dementia from alternate level of care?
Okay, thanks, Lori. And I think this kind of combines some of the responses from before about how when homes are taking new residents, they need to be able to care for them. And so, if a new resident is being admitted into long-term care and they have dementia and need additional supports, there are new programs available to access those supports, but that will be taken into consideration as part of the admissions process. The home will need to be able to provide those supports, specialized supports and services if an individual requires it, and if they don't have those specialized training and supports required, then they wouldn't be able to admit them.
All right, thanks, Anita. The next question that we've got is, what measures are homes expected to put in place to prevent wandering residents from transmitting viruses to other residents? And for this question, I'm not sure, Christine or Anita, which of you would be best positioned to respond on that one. I'll maybe defer to Christine first. Or Anita.
Thanks, Lori. Kind of similar to what Anita mentioned earlier around care plans. Homes should have, care plans in place and around preventing wandering of residents. We strongly encourage, everyone to wear masks, and of course, residents who have COVID-19 would be in isolation with appropriate precautions. I understand this can be a challenge for some homes to prevent this in all cases, but I think as part of their care plan, this is, the home would have a plan in place to help prevent this to the best of their ability. Anita, I don't know if you have anything else you want to add to that.
No, I think you got it. Thanks, Christine.
All right, thank you.
All right, our next question circles back to a question around staffing. And so, Aaron, I'll call on you again to consider the question around the increase in the number of hours of care per resident per day. suggests an increase in numbers of staff. How will Ministry of Long-Term Care assist homes to locate qualified vaccinated staff?
For sure, I can try to answer this question. This question might be better answered by our staffing supply branch, but I can try to answer this one. So in terms of staffing supply, as I mentioned, our staffing plan speaks to education and training pathways for staff in long-term care homes. So some of the initiatives that are currently being implemented is with respect to traditional pathways. So there's the expansion of PSW programs by up to 16,000 students in colleges and district school boards, as well as over 2,000 nursing students from last year, for example. In terms of bridging and laddering, to date, the government is investing up to $100 million into innovative programs to add up to 2,000 nurses by 24-25. And the government will also do this by supporting the training of thousands of PSWs and nurses who want to advance their careers in long-term care in collaboration with colleges in Ontario and we RPN. In terms of internationally educated nurses, in collaboration with Ontario Health, the government has also launched the Supervised Practice Experience Partnership Program and the LTC Staffing Pool to support internationally educated nurses to work in long-term care as well. And lastly, I'll just mention in terms of some clinical education, the Preceptor Resource and Education Program was also launched to provide long-term care homes with LTC-specific online education and backfill funding for preceptors' time spent training and supervising PSW and nursing students. So what I've just provided is just a bit of a snapshot, not everything. I'm just being cognizant of the time.
Thank you, Erin. I'm not sure if I'm queuing this in order. I'm going to move to a question that I see on my screen that speaks to funding and training regarding the funding to train more healthcare workers for long-term care homes. It takes time to train these workers. And how is the current critical shortage being addressed? Again, I think that this is speaks to staffing. And Erin, I'm hoping you might be able to reiterate some of those comments that you've already made and for us with respect to staffing.
For sure. As I just mentioned, there are a number of initiatives from short, medium to long term that are being implemented right now to address the critical staffing shortage issue. So as I mentioned, it's just with respect to traditional pathways, bridging and laddering, and internationally educated nurses. So I hope my previous answer helps address this additional question.
Thanks very much, Erin. I mean, certainly a theme that we're hearing through the questions that are being raised. There's obviously some considerations around staffing levels and care that's provided to residents. It's a theme that we're hearing throughout the session today, and a piece that I know there's lots of concern from people who are dialed into the call. So continue with those questions. For the next question, Anita, we've got a query that asks what service standards will be put in place and what training will discharge planners receive to ensure that they are respectful of family preferences and needs.
Great, thank you, Lori. And I'm not sure if the terminology is correct. So I'm just going to say that discharge planners, they are the hospital-based staff, and they determine when a hospital patient is no longer in need of hospital-based care, and they designate them as alternate level of care and work with others to help find them the appropriate place for them to be discharged to. So it's the placement coordinators at home and community care support services, and those staff determine the best destination for ALC or alternate level of care patients. And they do that through assessments, and it could be back to the community with supports. It could be to long-term care, or it could be to another community-based location. But specific to the long-term care placement, so these staff, the placement coordinators, are trained on the legislation and regulations as they pertain to admissions into long-term care. And so they've received additional training over the past few weeks on the new admissions process, the updated regulation, and also on the field guide that was developed specifically for them by the Ministry of Long-Term Care to provide additional direction to the placement coordinators about all of the context and considerations that need to be taken into account in addition to what's in regulation, and to really walk them through the entire process and what the expectations are, including that very important relationship with the ALC patient who's going to become a long-term care resident and their families and caregivers.
Thanks, Anita. I'm mindful of the time. I feel like our time is flying by. We do have time for one more question. And Christine, I think it's going to come your way for this last one. The question is, could you please advise or confirm whether the Moderna bivalent covers BA4 and BA5 variant? And please advise if it's safe to take if one's been vaccinated with the Pfizer for 4 doses. So Christine, I'm going to pass it on to you.
Thanks, Lori. And I know there was also another question around if someone has had a 4th dose, are they required to get the new vaccine? So I'm happy to be able to answer both of those right now. So firstly, the Moderna bivalent that is currently available offers protection against the original strain of COVID-19 and also the Omicron variant. It was created with, at the time it was BA1. However, they have done clinical studies and have found that it is also effective against BA4 and BA5 variants of Omicron, and more effective than the original COVID-19 vaccines. There are further studies and additional kind of Health Canada approvals on bivalents that would also specifically be on the BA4, BA5, but those we're still waiting for results from those. In terms of the safety, the Moderna bivalent has been approved and is deemed safe for anyone to take, whether you've received Moderna or Pfizer previously. So we strongly encourage everyone who's eligible for the bivalent, especially if it's been more than 6 months since your last dose, to take up the bivalent for this fall in preparation for the fall season. So just to reiterate, the eligibility is you can get your bivalent booster dose if at least 3 months have passed since your last dose. And it doesn't matter how many booster doses you may have had. If you've had a total of like 3 or 4 doses, what's important is that there's been at least 3 months since your last dose. And the recommendation is for around 6 months from your last dose. So thank you for the opportunity to clarify that.
Thank you, Christine. All right, we're coming up on the close of our time today. So I really did want to extend a thank you to everyone who took time to join us today, to everyone who raised questions. It's certainly apparent that families and caregivers are so engaged in support for their loved ones. We see that through the questions that we've received. And again, my thanks to everybody for joining us. And I'd like to reiterate again, our thanks to Family Councils Ontario for helping to support this webinar today. We'll be sharing the deck with Family Councils Ontario to make sure that we've got it shared with all of you. So with that, I'm going to turn it back to Sam for any closing comments.
Thank you so much, Lori, and thank you to all of our speakers today. On behalf of FCO and our attendees, thank you for all the time you've spent preparing for and delivering this important content directly to caregivers and council members. And a thank you to those of you who have joined today's session. We know this is really important to you to hear not only directly from the ministry, but on this information specifically. You joining us together to spend this time is a testament to how much you care about what happens to our long-term care sector, homes across Ontario, and the many thousands of residents and caregivers who form these important communities. Just a reminder, the webinar has been recorded, originally aired on September 21st, 2022. The recording will be posted to our YouTube channel and cross-posted to our website in the coming days. Stay tuned for the link via the Family Council's Ontario Weekly e-Bulletin. If you aren't signed up for that, please go to fco.ngo to find the information. We strongly encourage you to share these materials with your peers when it comes out, so please stay tuned for that. Final thank you to everyone, our speakers, our attendees, everyone who's joining us live or watching the recording after. Take care and stay safe, and we look forward to seeing you again. Thank you, everyone.